All right. Welcome everybody to today's lunch webinar, which is titled Food Access and Safety in Stockholm, Crime, Social Environment and Access to Healthy Food. And my name is Jonatan Abraham. I'm the host of this webinar series, which is hosted by Safe Places Network here at KTH, Royal Institute of Technology. And this is actually the final webinar webinar in this series. And for those of you who still might be new, this Safe Places Network is interdisciplinary network bringing research, education, and practice together on the topics of safety, security, and crime, and especially the role of the physical environment. And today's webinar fits still very much into this theme, but has a little bit of a twist, because while we're talking about safety and security, this seminar broadens the concept a little bit and talks about food security also. So the safety of the urban environment turns out to also shape who gets to eat well and who does not. Our speakers today is Dr. Ioannidis and Professor Vania Ceccato, who will introduce themselves a bit shortly, have conducted a spatial analysis of Stockholm Municipality, examining how crime patterns, socioeconomic and demographic factors intersect with the distribution of what they call food deserts, food swamps, and food oases. And today they will share their current findings. But yeah, first welcome, Ioannis.
Thank you, Jonatan, and thank you for the introduction. So my name is Ioannidis, and I'm a postdoctoral researcher here at KTH, and I'm leading this project on food access, and with different aspects of it, and one of it is safety that we will discuss here today.
Yeah. And my name is Vania Ceccato, and in this project I'm cooperating with Ioannis, looking at, in particular, the aspect of safety in relation to access to health food.
Thank you. And so, yeah, like I said, this webinar shifts a little bit our focus to the topics of accessibility, community welfare. So. And how citizens access food and so on. But why should we then investigate food access and safety specifically?
Well, everyone needs to eat, right? But if you think more seriously, we can think about access to food as a fundamental human need and a basic right. Yet the ability to have access to food is not equally experienced by different groups in society. People differing in age, physical abilities, and socioeconomic circumstances. And we know that these differences shape how easily individuals have access to food. So the problem is that most of this research in access to food are focused on, accessibility to the stores. And we know that you are going to talk a little bit more about that later. Different stores are not the same, and most of this research has focused on accessibility to stores, but also affordability. Our take was more, the physical environment is also different. Some areas are safe, others are not. And we know that some groups avoid certain places during the evening, and maybe that also affect access to food. Why people would be avoiding certain places when they, supposedly would have access to, for instance, a supermarket. So we wanted to understand the interactions between, in this case, safety and access to food.
Hey, you said something about how not all food stores are the same, not all food access is the same. Could you explain a little bit more about that?
I can talk about that. Yeah, so having access to a fast food store, it's not the same, of course, as having access to a grocery store. You get a different variety of options. Today, it's not easy to say what healthy food is. There are different ways of classifying food store. In this paper, we focused on classifying, providing consistent access to fresh products. This is a healthy environment to us. And we can see, for example, in this case, a big supermarket is a healthy facility, a fast food is classified as an unhealthy. So this is how we classify the food stores. But we have another classification, which is the important one we use here, and it's the classification of food environments. And how we define that? We define like 3 different classes. We have the food deserts, so no access to healthy food. We have no access to supermarket and those kinds of facilities. Food oasis, it has at least one full-scale supermarket, and the options for unhealthy stores are very limited. And also we have food swamps, which is environments where unhealthy options dominate the healthy ones. So this classification is what we're going to use as our base of analysis later on.
Mm-hmm. So what are the core dimensions or core objectives driving your study then?
Yeah, obviously we wanted to understand, how many people were having access to good food here in Stockholm, and this is break down in 3 main questions. How many people in Stockholm have access to health food? Of course, does safety access to affect access to health food? And the third is we are interested in the groups. So it's not only a question about having or not having a store there, but whether that different groups have access. So students or low-income groups, or for instance older population. So who has good and bad access to healthy food in Stockholm, split by groups.
Mm-hmm. And you obviously worked with a lot of different types of data and different methodologies. So could you tell us a bit more about what are your data framework and methods?
Yeah, that's the hard part, setting up the data and the methods, usually, especially the data. But I can say that we used urban infrastructure data, so food stores, residential buildings, the density of the buildings counted with used by apartment counts, and also the pedestrian, cycling, and public transport network, because we wanted to do accessibility for different modes also, which are important in the Stockholm's context. We also used demographic data, proportion of low-income population, of youth population, elderly population, and women population. And we have this data, and then we also have the crime records, which are important in this context because we are studying safety, and through the crime records acquired by Stockholm Police Authority, we managed to do that. It's outdoor violence, street theft, and narcotics, the 3 crime categories that we operationalize here. So these are the data. Moving into the methods, we split in 2 parts. The first part is the accessibility analysis, which we did from the residential buildings. So for the residential buildings in Stockholm, we measured the service area that they cover with network isochrons for walking, cycling, and scheduled public transit network. In that isochrons, we also classified if that building is considered a food oasis, a food desert, or a food swamp. And we used this classification as the dependent variable in our modeling, which is multinomial logistic regression. And we used oasis as the best baseline reference in this category, in this modeling. And then we have the second part, which is about the food stores, how those environments are enclosed in crime, and how they are exposed to crime. So we use kernel density estimation, and then we use the classification of food stores into healthy, neutral, and unhealthy. But also we kept the original classification per food store. So these are the data and methods.
Mm-hmm. And if you go to your first objective, then so how many people have actually access to these food oases that you mentioned?
Yeah. So we can see here we use food oasis as our base, so we're going to focus on that for now, but we'll mention the others. So in Stockholm, access by walking in an oasis, it has 24% of the population. 46, almost double, has access by public transport. So we see a very good increase. What we need to mention is that deserts, which are the areas that don't have any access, go from 36% by walking to 10% by public transport. And when we compare the walking, at least, with other cities, we see that, for example, Baltimore has a bit lower food deserts, but in another study in Brazil, there is higher presence, higher proportion of food deserts for the population. Something that needs to be said here is that in most other studies, the measurement is done through Euclidean distance, while we here operationalize the actual network for all three options. So, yeah.
Yeah. So, and what about the geography of these different oases and deserts and so on?
This is interesting also because the graph just shows an average and it doesn't show the differences in geography in the distribution. So we see here that swamp areas are mostly found in the city center, in the inner city of Stockholm, and then move a bit to the south part of Stockholm, while deserts are more peripheral, and we can see though they are in different areas in context. So we have in villa areas where we have single family houses, people have access to cars in those areas, have a different options and different economic status most of the times. And this is the map we see here is accessibility by public transport. So even though they are a desert, they might not have a problem because they have a car. On the other hand, in student areas, on the upper part of the map that we have highlighted, there it's mostly students, it's a campus, it's an accommodation. And there people rely by walking, biking sometimes, and also public transport. But public transport there doesn't serve them very well. So this is something we notice that helps us in the later steps of the project.
Okay. And I guess since it varies by geography and you see by student area, does this vary also by population groups?
Yeah, particularly we will gonna focus only in the low income. We're not gonna show all of them. So what we see here, like we already see an improvement in accessing food oases. From 24% it was for the general population going to 40%. So, and then the access by public transport goes even higher. So that gives us an understanding that maybe low-income people are served well in this city, but we will see. I think we will learn more through the modeling later on. So I think that's an important result to show because we talk about these different groups and how they are affected.
And I guess on that point also, you show now, okay, so people have different access to these food access in general, and then they have also different access to different modes of transport. But even if you have access to public transport and so on, there might be factors that makes you not want to use them. For instance, very much the theme of today, the topic of safety and crime, that makes you avoid public transport, for instance. So I guess the point here is how did you see how crime varied with these food environments that you mentioned also?
Yes, as Ioannis mentioned before, the modeling that we run control for a number of other factors beyond safety, but the pattern that we see clearly here using food access to good, healthy food is that we have a higher chance of having, swamp. And in those areas is where you have, for instance, more street crime. You also have in the same dimension, we see higher chance of swamp, again here walk, in areas that have also more violence. So there is some sort of at least a spatial correlation between these locations, where some areas share both bad access to food, we could say, or at least swamp, which is a mixture of those, and more crime. We can see a little bit more clear in the next slide. But for now, I also would like another piece of information that comes from the modeling, which complements the rest, which is the using the food oases as the basis, or the people that have access to good food. We see that people run a higher chance of being a desert in places where there is also less violence or less street theft. And this coincides with some areas that are what we call the single family houses, which is like in Bromma, Äppelviken, you see that concentration. So there in the modeling, controlling for a number of factors, you see the results pooling into different directions. Sometimes the risk of crime being associated to swamps, but at the same time also access, let's say, deserts associated to areas that have less crime. So it's still part of the same dynamic into one model. And what we are using here as a basis is the people that have access to good food. So in relation to those groups, here we can see this pattern, the relation to access to swamp and access to, or let's say, the presence of people in desert, which in this case has less crime, which seems to contradictory. But in this kind of modeling, you compare groups of people. In this case, the base is people that have access to good food in relation to those that are in swamps and deserts.
Okay. Well, yeah, so you talk about the environments, but did you see also the specific food stores, the different categories there? Did you see any relationship with crimes?
Yes, so this is another side of the picture in which we looked at the environment where the stores are, and you see, for instance, a big concentration of fast food in places where there is also quite a lot of crime. And mostly these areas are inner city areas. They are also the areas where there is lots of fast food. You have what we call the swamps, right? So it is the inner city area mostly.
I think also it's interesting here that, for example, big supermarkets have very low, which are in areas that are not very central most of the time, so not much population movement maybe there. And also I think very interesting it's food markets, which is a bit higher than other like unhealthy stores. And that's because food markets in Stockholm are placed mostly in very central hub areas. If you think Harholmen, if you think like in city center, we have those. So I think that is an effect why we see a bit higher crime in those environments.
And you had some descriptive results of the different population groups, right? But I guess in the model, when you accounted for other factors, which groups were more impacted by this?
So yeah, this is the good and bad news. So the bad news is from the results of our modeling, at least, we see that young people are more exposed to deserts by 63%. So they have a higher chance being in those environments and not having access to healthy food at all. And on the other hand, on some good news, low-income people in Stockholm actually have a really good access. They have like a 64% less chance of being in a desert. And oases are based here, so they have like a higher chance of being in an oasis than being on a desert or a swamp. And similarly, elderly people have also a lower chance on being on a food desert than an oasis. And just to mention here that this is by public transport. The walking relationship is pretty similar with the young people and low income. Elder people have a higher chance of being in a swamp when they walk. And that I think is interesting to keep in mind.
And I guess very interesting results, but I guess what can we take from this? Like, what are your main takeaways and conclusions from this project?
So I think the first one is that Stockholm is similar to other cities. It has some better access from other cities, worse than other cities. I think what is important to say here is that public transport really helps improve the situation, and I think that's a very important part that motivates to keep on working in that aspect. And we see, for example, as we said, the food deserts from walking, which are 36% of population are in a walking food desert. In public transport, it goes to 11%. That's a very good, and that 11% probably is the people that live in villa areas that probably have a higher chance of owning a car, so they still get access. And just to mention, we also run car analysis, but every part of the city is covered, so we didn't include that. There was no reason for that. The second takeaway, I think.
Yes, I mean, which is also complementary to what you said. Good news of having low income, having access to good food, and that was clear in the map. In this map, the other takeaway is that crime may affect access to health food. One of the clear results we saw, which is here shown in this map, that show clearly the swamp area with Södermalm in the at the center there, and also where we are, but also some parts of the southern parts of Stockholm. Some of these areas are also high crime areas, so it might be that maybe people have a possibility of using some of these supermarkets, but may avoid to access them at particular times of the day because of the problems of safety. Of course, here we are talking about police recorded crime. We are not talking about perceived safety, but still there is this clear correlation between swamps and also a crime location, which is probably something that we needed to think in terms of questions about environmental justice, and how we can distribute population in relation to these inequalities, that probably you don't want to concentrate lots of beds towards particular groups. These groups have both bad access or relatively bad access to food, but also bad situation in terms of safety. And the question is, how can we improve this situation? It's inner city areas, so it has a particular dynamic, but that is a clear takeaway here.
And I think the last one, one of the main takeaways, is that access depends on who is the demand, who is using those networks and those facilities. And as we said, we have good and bad news. Low-income population with public transport live in food oases, and this is a motivation for to keep improving public transport, keep making it more accessible. And then we have student population in food deserts, which is one of the negative ones and the bad news. And this is something I found from experience, actually, and that was one of the motivations of this project, that where I lived as a student had really not a good access to healthy food, and that affects like your everyday life. And the third one is that older adults in not pity swamp here, that's it's a walk swamp. So it's older adults might be very affected, as Vania said. So mobility constraints increase that. Safety constraints might increase even further the use of public transport or of even walking for people to actually walk in their environments. If they live in a very central area, they might be reluctant on that aspect. So I think we can, from how we measured and how we identified the situation in Stockholm, I think good and bad news can help us move further on what we do well and what we don't do well in the city.
Okay. So do you have any recommendations or anything from this project at this point?
Yeah.
Yes, I think we need to improve food access to different society groups. In particular, I mean, students, we mentioned there. There is also the question of thinking about this is what we have now, right? The question is, how can we build new residential areas where we can start right from the beginning? We normally say that we can plan residential areas safe from the beginning, or at least try to do our best to make sure that areas are planned in a safe manner. But the question is, how can we do also that for food access? And the question is, well, just put a full-scale supermarket and that is guaranteed. So I think that is depend on who will be there, we'll be having access to good food, assuming that a supermarket will offer that guarantee.
And to add on that, sorry Vania, add on that, I think it's very interesting that studies and surveys had showed that most municipalities don't consider access to food. They consider access to public transport, they consider different services, but one of the understudied is the food store, then the food accessibility environment. So I think that comes in that.
That is a good recommendation for Stockholm Stad and also to other municipalities around the world that are approving, new projects. Guarantee access to school and access public transportation, but also to food. Another thing is, based on our results, is that we cannot do a lot about inner city areas, define the one bullet that will fix all the areas that are food swamps, because they are typical, mixed land use with lots of good things, right? In terms of activities, entertaining, and so on. So one thing that probably needs to be said is that we need to monitor those areas and take a look on specific areas in a micro perspective, and see how we can monitor that particular area over time to make sure that swamps don't become actually deserts, and maybe transition to instead to food oases. And that's a question also of governance, to make sure that you can work with food supply chains to make sure that those developments happen also in city center areas.
Because we know examples where like food store decided to leave an area because it was too crimogenic. they had to like close the store because
Exactly, especially here in Stockholm, in which we see, threats being happening towards, small facilities, but also big ones. So, of course, this is something that we have not directly analyzed, but definitely it is a path that we would be interested in looking how retail is affected by crime, and in this particular case, access to food. That's a good point, and maybe a future study. Definitely,
exactly.
We need to think about implement safety measures. In particular, I think in inner city areas, which I think here in Stockholm is definitely an area that should be considered as a target.
Yeah.
And then I would like to mention also some limitations in the study. They are important. So we didn't look at temporal differences. Weekday, weekend, we took the optimal case like for this study. And we didn't look also on terrain differences, so how slope affects walking, so how these might affect and also biking, the active modes. The store categorization, as I said, there are different ways, but in this threshold of these three classes of oases, swamps, and deserts, we followed that categorization from literature. And I think if you categorize differently, maybe there is a different access. And finally, crime records. We used crime records and not perceived safety, as Vania mentioned. Implementing safety measures, safety calculations may be a way to move to see if there is any difference in where crime actually happens or where people feel unsafe. It's two different things sometimes. So this is where we finalize. I would like to mention before we finish that this is a project that is supported and funded by KTH Food Center, and we thank you for that. And also we have some stakeholders in this project, which is Stockholm Municipality and some grocery stores. And of course, I would like to thank Vania also for the collaboration.
All right. Thank you very much. Very interesting project, very interesting results also. And I guess we open up for questions from the audience now. And I see we have some questions in the chat already. And I see someone that says, to what extent do you think the structure of the city affects accessibility?
Yeah. Yes, definitely. It's something that we should be considering, because a city like Stockholm, composed of islands, is an archipelago, right? It does have an effect of accessibility, looks like, and not only to food stores, but everything we think about it, compared to cities that are more, let's say, concentrated. I'm thinking now about São Paulo, but there is also the question about how even the urban fabric is created. Think about one car-based city like some of the cities, maybe modern cities in Brazil, but also, of course, in the United States. All those basic background would definitely affect whether people will walk to the store, take a car, and so on. So it is an implication not only to have access, but also being healthy in terms of if you can walk or not. Walking would promote healthier also lifestyles and so on. So I would say we haven't tested the structure of the city, and basically we would need to use probably multiple cities to be able to do that. But definitely could be an interesting thing. You mentioned about slope. I guess not many people would like to go to the supermarket if there is a very hilly, the supermarket is at the top of the mountain there.
Carrying groceries with on a hill, it's
exactly.
extra
And this
effort.
makes even worse when you are older. So there is this interactions between groups of users and the structure of the city and so on. So this has not yet been studied, but definitely a new frontier for research.
Nice. We have a question from Duan. Greeting from Recife, everyone. Could you please detail a little bit more about how did you classify the space as oases, swamps, and deserts? Any sort of data processing? Did you consider the counts per type of establishment and so on?
Yeah, so we used, of course, some other studies, but we used the CDC measurement. So CDC has a measurement about, it's called Modified Retail Food Environment Index. So what it measures through that is the amount of healthy and unhealthy food stores that are present in the area you want to analyze. In this case, we analyzed the service area of each individual residential building. So through that, it counts all the points, so healthy, unhealthy, and then it builds the index to have a 0 to 1 categorization, with 0 meaning you have no access to healthy food. Up until 0.2, it means you have good access to healthy food with not many unhealthy establishments. Everything above that then becomes like a swamp. That's how it's it's divided through these studies that we used as examples. And we used those because it was the ones that have all these three, like food, desert, swamps, and oases. Most studies usually focus on the desert. Especially in previous years. Lately, people have started identifying that a swamp is a problem also. It's not just not having access, but having access to bad food is also like a problem. That to answer. And there was a lot of data processing. There was a lot of cleaning data, analyzing data, categorizing them, and see how that changes the situation.
All right. And there's a question from Dilawais Ali, and it says, hello, could you please mention what kind of analysis has been used in the study? Is there any modeling technique used? I think you mentioned quickly there before, right?
Yeah, we said that we use mostly exploratory spatial analysis in general, and just to identify patterns. And then we used isochrome calculation. In this case, I used Python to do the calculations. Network X was used and for public transport, if I remember. For the walking and cycling, and then for public transport we used the OTP, the OpenTree Planner. So through that, those are the two ways that we calculated the data, and then with spatial overlay we see how many crime points, how many food establishments are in those isochromes that we calculated. And then at the final step we also did correlation analysis, just to make sure that the variables we're testing are not correlating with each other. And also the final step, which was in one case was the modeling, the multinomial modeling. In the other case it was the kernel density estimation and the calculation of the crime exposure in food stores. Overall, I shouldn't go into detail. It will be in some paper that will be there.
Sure. All right, and there's a question from Luis Nonato. Why do you think eyes on the streets is not curbing crimes in swamps, which I assume are locations with higher flow of people?
Yes, I mean, we are talking about an area that is city center. Probably it is. It's an area that even if the eyes on the streets are there, maybe not many people would be ready to intervene. So just the fact of having flow of people does not guarantee guardianship. And we also needed to assume that the fact of having stores and things like that depends on the kinds of stores that you have there. It's not only establishment that you would expect that people would own the area, in the sense that they would keep an eye on what is happening outside. Sometimes if it is a commercial area, maybe in the evening it's quite busy and the place in itself is empty, so it's quite unguarded, although the flow of people is happening. I think the Södermalm is the most important example of that. So there are also locations where you have lots of restaurants, people drink, so a number of activities happening there. So you can assume that flow of people would do the trick, but it's not automatic. Many people passing by would not stop to intervene if anything happens, just because they are just passing, or it's just that they don't feel at all attached to the area. Areas that converge people tend to have this type of characteristic. It's just a typical transit place. So it's kind of hard to, it's not like a residential area that probably you would intervene because very well people there, all the little corners and things like that. People are sometimes also afraid of intervening in places where they know very little about the context. Right. So I think and on top of that, of course, you have also Södermalm, which is that area, central area there. You have lots of people that also attract tourists that are notoriously known by not being very, they don't know very much where they are. So this can also create, at least potentially, more victimization, because maybe people are exposed to areas that they shouldn't be at particular times. Maybe people that know very well that area, as well know, they would avoid certain spots. So again, there is a whole dynamic, I would say, in this city center swamps, I would say, not for more the periphery, because the periphery, I guess, you do not necessarily have the eyes on the street. But the inner city areas, which is the big chunk of swamps, they are characterized by places of convergence where this idea of eyes on the streets are put, at pressure, because, not many people would. Familiarity is not what is driving people to intervene. Right.
There's a difference between just guardianship and capable guardianship. Right?
Absolutely. That's it.
Okay, so we have another question from David Sumegi. Says, hello, what spatial overlaps exist in Stockholm between gentrified areas and areas affected by touristification and the presence of healthy food options?
Oh, that is fun, because I didn't look at this question before.
I can say we haven't specifically investigated these effects in the environment and how that might affect the presence of healthy food. But that sounds like an interesting future part. We can say we know swamp areas are very tourist areas. The inner city in general, especially Vasastan and Södermalm, are very high movement in tourism population. So probably they have some effect. I don't know how much a tourist is interested when going on 3-day vacation about healthy food. Some probably are, but you can find restaurants also with healthy food sometimes. So I'm not sure in this one how to I don't have some.
Well, we can see these overlaps in Södermalm. You know, the gentrified the areas, which is typically in you know, at least a typical gentrified area is Södermalm, right? So I think you get read that, especially in that area. For other parts of the city, maybe would involve some parts of Kungsholmen, but here I'm just guessing.
Yeah.
We just
haven't,
no, we haven't done any analysis of that, but only by looking at the maps, you could talk about the different types of coffee chains that have in those areas that, of course, don't only attract tourists. It's everybody that wants to have a cup of coffee or a cappuccino. And, I mean, that necessarily doesn't need it to be, you know, bad. But, you know, if it's only that you get on an everyday basis is probably not a good thing. So,
yeah. Or do you want to add that?
No.
Yeah, well, yeah, interesting question, and maybe something you could dig into future research also. Yeah. There's another question. Is that you mentioned that municipalities often overlook this, but yeah, what mandate do they have to influence this? What actions can they take? If you've considered that or thought about that.
Well, the same, like when in Swedish case at least, the municipality has the overall oversight of building a new area, for example. So it's their responsibility on how to properly provide access to different services. And public transport is an important one, of course, because it gives people the chance to move between spaces. So in that context, as Vania said, also schools are important to have access. In the same way, we need to think about how important food is, and especially healthy food, how important it is to have good access in our lives. So I think that's where, I don't know the law specifically, but I know they have some mandate to affect decisions on where the public transport should be placed, or where do we have a school in the area. They have some motivation on that. I don't know if Vania wants to.
No, I agree completely. I think the word that you were looking for was in Swedish municipalities, the municipalities have a monopoly, right, on defining. And I think if a new residential areas is going to be built, then I think it's up to the municipality to define what they want. So the housing companies can, put. Organize or plan in a way that the question about access to supermarkets are already there from the beginning. So I don't think that it would be a big move. It just would make sure that, for instance, kids can go. I mean, when I was a child, it was kind of fun. Probably one of the funniest things to do, to go to the supermarket. And nowadays, if you needed to take a car to do that, it's, you are completely isolated. And that is the case perhaps in single family houses in some of the areas here in Sweden. So promoting walking towards these fun places for kids can be also fun, as it was in the past. So it's just a question of deciding and go for it, I think.
And I think we need to say that, okay, you can't force a supermarket to open their store there. You, as a municipality, you make the plan that, okay, in that area we can have a supermarket that serves the whole population of this new place. And of course you can't make, for example, ICA and tell them, okay, you have to open here. You can, but you can give incentives. You can, and I'm sure most supermarkets would want to open in a new area if they are the only ones serving that area, maybe. So they got
But also, as you said, you don't want the supermarkets to leave because of threat of crime. In some of the areas, we have seen colleagues from retail sector talking about crime as being a big threat for their business. So it's not only building new areas, but also creating groups or programs in which people can work together to avoid the problems of crime around and at the stores.
And with the change in the law last year, that municipalities has more responsibility on safety and crime prevention, I think that's also one where it hooks with what they can do.
Okay, and I think that was a kind of a good finish also to the discussion. I don't see any more questions right now, so I'd like to just say thank you for once again a very interesting project, very nice discussion, answer the question. Thank you to the audience also for all the questions there. And like I said, this is actually the final launch webinar in this series. What a ride, right? We went from explosions here in Stockholm to safety in parks, to how place management relates to safety, to how the street network shapes the car theft and so on, and then now finally how safety and food security is linked. So I think we go back, if you've missed any one, you can see the recorded sessions online on the Safe Place Network, or even at I think at KTH, right? So I think once again, thank you to everybody.
Thank you so much for being our host. Thank you.
Through the whole series, but for today also. Thank you for the...
Thank you so much.
Yeah, it's been very fun. So, but to the audience out there, I'd say see you next time whenever we meet.
Yeah.
All right.
Thank you.
Bye-bye.